Hello and welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. Today, we're discussing 5 medications that, while commonly prescribed, doctors often avoid taking for extended periods. In my view, these medications should be used with caution, especially for long-term treatment. Prolonged medication use typically suggests the presence of a chronic condition. Addressing only the symptoms without treating the root cause can be problematic. While temporary relief is important to reduce stress and improve the quality of life, relying on medications for too long without targeting the underlying issue raises concerns. In this discussion, I will explore 5 types of medications that many doctors prefer to avoid over long periods. Let's begin. 1. Painkillers, non-steroidal anti-inflammatory drugs or NSAIDs. First on the list are painkillers known as NSAIDs, non-steroidal anti-inflammatory drugs, among the most widely used medications globally. Common examples include ibuprofen, diclofenac, Voltaren, and loxaprofen, Loxonin. While some of these are available over the counter, their extended use comes with significant risks. Large-scale studies have revealed that long-term use of NSAIDs can increase the risk of heart failure by about 20%, with higher doses and longer durations magnifying this risk. Additionally, NSAIDs are notorious for causing gastrointestinal issues, including ulcers and bleeding in the digestive tract. In severe cases, users may even experience stomach or intestinal perforations. Prolonged use of these medications is a leading cause of bleeding ulcers. Another significant concern is the effect of NSAIDs on kidney function. Regular use can impair kidney function, leading to fluid retention and swelling. Although some individuals may not exhibit visible swelling, about 5% will show noticeable signs. Because of these potential cardiac, gastrointestinal, and renal complications, it's advisable to limit NSAID use and focus on addressing the source of the pain, whether it's knee, back, or another issue, rather than relying on painkillers over the long term. Beyond these risks, long-term NSAID use is also linked to other side effects like dizziness, headaches, and allergic reactions. Some individuals develop severe allergic responses, such as skin rashes, breathing difficulties, or facial swelling. While NSAIDs effectively reduce pain and inflammation, they do not resolve the underlying issue causing the discomfort. Therefore, it's crucial to consult with a healthcare professional to diagnose and treat the root cause of the pain rather than simply managing symptoms. Safer and more natural alternatives for pain relief include relaxation techniques, low-impact exercises, physical therapy, and acupuncture. Adopting healthy lifestyle habits, such as maintaining proper posture, engaging in regular exercise, and managing body weight, can also help alleviate and prevent chronic pain. In cases of acute pain or when NSAIDs are necessary, it's vital to adhere to medical advice, follow dosage instructions, and respect the recommended treatment duration. Overusing these medications without guidance can pose serious health risks. Whenever possible, consider safer alternatives and be mindful of potential side effects associated with prolonged NSAID use. 2. Statins, which are commonly prescribed to lower cholesterol levels and reduce the risk of heart disease. Statins, discovered by Japanese scientist Dr. Akira Endo, are considered one of the most significant medical breakthroughs. Studies suggest that statins can lower the risk of heart disease by 30% to 40%. However, interpreting this data more closely reveals that in a large study, 3% of participants who didn't take statins experienced heart attacks, while this number dropped to 2% for those on the medication. While this is often reported as a 30% relative reduction, in absolute terms, it's only a 1% difference. This means that for every one person whose heart attack is prevented by statins, many others take the drug without direct benefit. Moreover, statins come with several potential side effects, which can impact the decision to use them long-term. Muscle damage is one concern, with some individuals developing conditions like rhabdomyolysis, which involves the breakdown of muscle tissue. Statins can also cause mitochondrial dysfunction, impairing cellular energy production. In some cases, long-term statin use has been linked to an increased risk of hemorrhagic stroke, which is bleeding in the brain. For people who have already had a heart attack or are at high cardiovascular risk, the benefits of taking statins often outweigh the risks, making them a necessary treatment. However, for individuals with only high cholesterol and no other heart disease risk factors, lifestyle changes may offer a healthier, more sustainable approach to managing cholesterol. Personally, I would avoid long-term statin use in such cases, opting instead to address high cholesterol through dietary and lifestyle adjustments. One particularly concerning potential side effect of long-term statin use is an increased risk of developing type 2 diabetes. Research has shown that prolonged statin use may increase the risk of diabetes by up to 50%. Since diabetes itself is a significant risk factor for heart disease, this introduces a new layer of complexity to long-term statin therapy. In addition to the diabetes risk, some users report cognitive issues with statins, including memory loss, confusion, and difficulty concentrating. Though these cognitive side effects are typically reversible once the medication is stopped, they can negatively impact the quality of life during treatment. It's crucial to recognize that statins may still be necessary for people at high risk of cardiovascular disease, particularly those with a history of heart attacks or other serious conditions. However, for individuals where high cholesterol is the sole concern, alternative methods such as adopting a heart-healthy diet, rich in fruits, vegetables, whole grains, and healthy fats, engaging in regular physical activity, and stress management might be more beneficial long-term. Maintaining a healthy weight and avoiding smoking are also essential in reducing heart disease risk. Before starting or discontinuing statin therapy, it's vital to consult with a healthcare provider who can assess individual risks and benefits. Every person has unique health needs, and a professional can offer personalized advice on the best approach to managing cholesterol and reducing heart disease risk. Stay tuned as we delve deeper into the 5 medications that doctors never take, but you take without knowing. Remember to like, share, and subscribe to support our channel and stay informed about your health. 3. Sleep medications, specifically Zolpidem and other hypnotics, which are commonly marketed under names like Stilnox or Ambien. These medications are frequently prescribed to treat insomnia because they act quickly and help people fall asleep for short durations. However, the long-term use of Zolpidem carries significant risks that make it unsuitable for extended periods. One of the primary concerns is the increased risk of falls, especially in elderly patients, due to the dizziness and daytime drowsiness often associated with these medications. For older individuals, this heightened fall risk can lead to serious injuries. Another worrying side effect is the potential for abnormal behaviors, such as nonsensical conversations or the inability to recall events that occurred during or after taking the medication. This phenomenon, known as anterograde amnesia, can impair daily functioning. Additionally, over-reliance on sleep medications can lead to dependence, meaning that patients may feel unable to sleep without them. When abruptly discontinued, users often experience rebound insomnia, where sleep problems return more severely than before, or they may endure withdrawal symptoms. This can create a vicious cycle where individuals feel trapped in a pattern of medication use, driven by an exaggerated fear of not being able to sleep, further worsening their anxiety and insomnia. Instead of relying on medications for long-term sleep aid, it is far more effective to adopt behavioral changes and improve sleep hygiene. Sleep hygiene involves making lifestyle adjustments that promote better sleep quality, such as going to bed only when genuinely feeling sleepy, avoiding the use of electronic devices in bed, and maintaining a consistent wake-up time, even after a restless night. Activities like meditation, reading, or other calming practices before bed can also help signal to the body that it's time to sleep. Aside from the physical risks, prolonged use of sleep medications can negatively impact sleep quality itself. Although these medications may help induce sleep, they often disrupt the body's natural sleep cycles, particularly REM sleep, the stage of sleep crucial for mental restoration. This can result in people waking up feeling unrefreshed, even after a full night's sleep, because they haven't experienced the deep, restorative sleep their bodies need. Another significant concern is the potential for drug interactions. Zolpidem and similar sleep aids are metabolized by the liver and can interact with other medications, alcohol, or even certain foods. These interactions can increase the likelihood of side effects or make the medication less effective. For those who take other medications or have underlying health conditions, this risk becomes even more important to consider. It's also vital to recognize that insomnia may be a symptom of underlying issues such as anxiety or depression. In these cases, simply masking the sleep problem with medication doesn't address the root cause, and patients may benefit more from treatments like cognitive behavioral therapy, CBT. CBT is an evidence-based, non-drug approach that helps people identify and change thoughts and behaviors that contribute to insomnia, providing longer-lasting improvements in sleep quality. In addition to CBT, other strategies for enhancing sleep quality include creating a comfortable, quiet sleep environment, engaging in regular physical activity, while avoiding intense exercise close to bedtime, and limiting the intake of caffeine and alcohol, particularly in the evening. Learning to manage stress through relaxation techniques, such as deep breathing exercises or yoga, can also be highly effective in promoting restful sleep. For individuals suffering from chronic or severe insomnia, it's important to seek medical advice to assess the underlying causes and develop an appropriate treatment plan. While sleep medications may be necessary in certain cases, it's crucial to carefully weigh the risks and benefits of long-term use. Exploring safer, more sustainable alternatives to medication, whenever possible, should always be a priority. 4. SGLT2 inhibitors, commonly prescribed for managing type 2 diabetes. These medications work by preventing the reabsorption of glucose in the kidneys, leading to the excretion of excess glucose through the urine. While this effectively lowers blood sugar levels, it also comes with several risks that can affect a patient's overall health, particularly with prolonged use. One of the most notable risks is the increased likelihood of urinary and genital infections, especially in women. This occurs because the excess glucose in the urine provides a fertile environment for bacteria and yeast, making infections more likely. Repeated infections can cause discomfort and may require additional treatments, complicating the patient's health management. In addition to infection risks, the loss of glucose through urine can result in fatigue, weakness, and dehydration. Glucose is the body's main energy source, so losing too much can leave individuals feeling drained. Furthermore, the diuretic effect of these medications causes water loss, making it important for patients to drink enough fluids to stay hydrated. For some patients, particularly those with diabetes complicated by heart or kidney disease, SGLT2 inhibitors may provide significant benefits. However, for others, especially those without such complications, it's important to consider alternative methods to control blood sugar levels before resorting to these medications for the long term. Lifestyle changes, such as adopting a healthy diet, regular exercise, and weight management, should be prioritized as first-line strategies for managing type 2 diabetes. Even modest weight loss can greatly improve insulin sensitivity and potentially reduce or eliminate the need for medications. One of the more serious potential side effects of SGLT2 inhibitors is an increased risk of diabetic ketoacidosis, DKA. Although DKA is more commonly associated with type 1 diabetes, It can occur in type 2 diabetics using SGLT2 inhibitors. DCA happens when the body cannot produce enough insulin, leading to the buildup of ketones, acidic byproducts of fat metabolism, in the blood. This can cause dangerous symptoms such as nausea, vomiting, abdominal pain, confusion, and shortness of breath. If untreated, DKA can lead to coma or even death. Although rare, it's a life-threatening condition that requires immediate medical attention. Another significant concern associated with SGLT2 inhibitors is the potential for amputations, particularly of the toes or legs. This risk is especially high in patients who have peripheral artery disease or diabetic neuropathy, conditions that already impair blood flow and nerve function in the lower extremities. These patients must be particularly vigilant in monitoring the health of their feet and legs, as even minor injuries, ulcers, or infections can escalate quickly. It's crucial that patients using these medications regularly inspect their feet for any signs of wounds, ulcers, or infections and report them to their healthcare provider immediately. For many people with type 2 diabetes, lifestyle interventions can be enough to control blood glucose levels without needing medications like SGLT2 inhibitors. Exercise and a well-balanced, low-sugar diet can make a substantial difference, even in cases where diabetes is well established. Modest weight loss, even as little as 5–10% of body weight, has been shown to significantly improve insulin sensitivity, reducing the need for medications. If lifestyle changes are not sufficient to manage diabetes, metformin is generally the first-line medication. It is widely regarded as effective, safe, and well tolerated by most patients. Metformin helps lower blood sugar by improving insulin sensitivity without the increased risks associated with SGLT2 inhibitors, such as infections or amputations. Only when other options have been exhausted, or in cases where additional benefits, like heart or kidney protection, are needed, should SGLT2 inhibitors be considered. For patients who do need to use SGLT2 inhibitors, close monitoring is essential to catch any potential complications early. It's vital for patients to maintain proper hydration to avoid dehydration and to promptly report any signs of urinary or genital infections, diabetic ketoacidosis, or foot and leg issues to their doctor. By carefully weighing the risks and benefits, and ensuring that any complications are swiftly addressed, patients and healthcare providers can work together to manage diabetes in the safest and most effective way possible. 5. Proton pump inhibitors, PPIs, such as omeprazole. PPIs are widely prescribed for conditions like acid reflux, gastroesophageal reflux disease, GERD, and stomach ulcers. These medications work by significantly reducing the amount of stomach acid produced, which helps alleviate reflux symptoms and allows ulcers to heal. However, while they are highly effective in the short term, prolonged use of PPIs comes with several health risks that can outweigh the benefits. One of the primary concerns with long-term PPI use is the risk of nutritional deficiencies. By reducing stomach acid, PPIs can interfere with the body's ability to absorb certain vital nutrients, including vitamin B12, magnesium, calcium, and iron. Over time, a deficiency in these nutrients can lead to a range of health problems. For example, vitamin B12 deficiency can result in neurological issues such as memory problems, fatigue, and nerve damage, while low calcium absorption may contribute to osteoporosis, a condition characterized by weakened bones and an increased risk of fractures. Another significant concern is the increased risk of infections. Stomach acid serves as a natural defense mechanism, helping to kill harmful bacteria before they can reach the intestines. By suppressing acid production, PPIs may allow harmful pathogens to survive and enter the digestive system, leading to an increased risk of infections such as pneumonia and Clostridium difficile, C. diff, a dangerous bacterium that causes severe diarrhea and can be life-threatening, particularly in elderly or immunocompromised individuals. Bone health is another area affected by long-term PPI use. The reduction in calcium absorption can lead to osteoporosis and an increased risk of bone fractures, particularly in the hip, spine, and wrist. This is especially concerning for older adults, who are already at higher risk for fractures due to age-related bone loss. Studies have shown a clear association between extended PPI use and an increased risk of bone fractures, making it crucial for individuals on these medications to monitor their bone health closely. In addition, prolonged PPI use has been linked to an increased risk of gastric cancer. While the exact mechanism is not fully understood, it is thought that by altering the stomach's natural acid balance, PPIs may promote the growth of harmful bacteria and increase the production of gastrin, a hormone that stimulates stomach acid production. Elevated gastrin levels over time may contribute to the development of certain types of gastric cancer. Drug interactions are another concern. PPIs can interfere with the absorption and effectiveness of several other medications, including blood thinners, antidepressants, and treatments for osteoporosis. These interactions can lead to serious complications, particularly in individuals taking multiple medications or those with underlying health conditions. For example, PPIs can reduce the effectiveness of clopidogrel, a commonly prescribed blood thinner used to prevent heart attacks and strokes, which can lead to potentially life-threatening outcomes. Interestingly, some studies suggest that simple lifestyle measures, such as drinking water, can provide temporary relief from acid reflux symptoms. This offers a non-pharmacological alternative to managing mild reflux without the risks associated with long-term PPI use. For many individuals, addressing the underlying causes of acid reflux, such as obesity, poor diet, and smoking, can be just as effective as medication in controlling symptoms. Weight loss, eating smaller meals, avoiding trigger foods, like spicy or fatty foods, and not lying down immediately after eating are all strategies that can help reduce reflux. If PPI use is necessary for managing conditions like stomach ulcers or erosive esophagitis, it is important that patients are closely monitored by a healthcare provider. The dose and duration of treatment should be minimized to reduce the risk of adverse effects. Additionally, patients should be cautioned against abruptly stopping PPI use, as this can lead to a rebound effect, where the stomach produces even more acid than before, worsening reflux symptoms. Gradual tapering under medical supervision is a safer approach to discontinuing these medications. In some cases, alternative treatments such as H2 receptor antagonists, e.g., famotidine, or antacids may be effective options for managing reflux symptoms without the risks associated with PPIs. These medications work in different ways to reduce stomach acid and may be more appropriate for long-term use in certain individuals. In conclusion, while PPIs can be essential for treating specific conditions, long-term use should be approached with caution. Addressing the root causes of reflux or ulcers through lifestyle changes, such as losing weight, improving diet, and avoiding smoking, can often be as effective as medication without the associated risks. If medication is necessary, it is important to work closely with a healthcare provider to carefully monitor for potential side effects and complications, ensuring the safest and most effective treatment approach. Thank you for watching, and if you found this information helpful, please give this video a thumbs up and subscribe if you have not already for more content like this. See you in the next video.